Good morning, good afternoon, and good evening, wherever you are. I'm Joanna Regulska. I'm the Vice Provost and Dean of Global Affairs at UC Davis, where I'm also a faculty member in the Department of Gender, Sexuality, and Women's Studies. Thank you so much for joining us today for the third panel of our Davis Global Conversation series. This is an ongoing event series we host to share knowledge among UC Davis, as well as UC Davis community, as well as external experts on topics of global importance. During the COVID-19 pandemic, this series helped us really to connect with each other, connect with our partners, connect around the world. This series features discussion with global and international leaders, talking about both the opportunities and challenges, the strategies, and of course, including in our conversation is the focus on the UN Sustainable Development Goals. Global Affairs is very pleased today to co-host today's event with the Feed for Future Innovation Lab for Markets, Risk and Resilience at UC Davis. Global Affairs at UC Davis advances the university's mission through global engagement and partnerships, such as this one today. And our mission is rather simple, but we believe powerful, to inspire global curiosity, understanding, and engagement. We support thousands of international students and scholars. We support thousands of students and faculty learning, researching, and engaging globally. We also facilitate collaborations that tackle the world's most pressing challenges through more than 150 global partnerships that are extremely important to us and to our collaborative work. We're excited that today's event coincides with the International Education Week, so welcome to our week focusing on international engagement. For almost 20 years, UC Davis has celebrated international education and exchange during International Education Week. This is an initiative by U.S. Department of State and Education. The week brings together opportunities to participate in cultural and educational programming, and I'm sure you can find something for yourself on our website. Today's discussion will focus on women's leadership, on how women's resilience, knowledge, skills, commitment make a difference around the world. We know that empowering women and investing in women's opportunities helps families and communities, but also countries, achieve food security and rise out of the poverty. As a woman, as a feminist geographer, but also as a scholar of gender and women's studies, and an advocate for gender equality myself, your work resonates very deeply with me. I look forward to hearing more from the panel about the work of the MMRR Innovation Lab and partners to improve lives and prosperity in northern Kenya. For those who want to learn more about this topic after today's events, the MRR Innovation Lab will be featured in the UC Davis Unfold podcast episode that was just released actually today. This season podcast is focusing on science and climate, and this episode is reporting directly from Kenya, where they're examining how climate change is punishing the world's poor and how insurance might protect them when droughts hit. I'm pleased to now turn it over to our moderator of our panel today, Michael Carter, who serves as the director of the Feed the Future Innovation Lab for Markets, Risk and Resilience, and is a distinguished professor of agriculture and resource economics at UC Davis. Michael, back to you.
Okay, thank you very much, Joanna. And on behalf of the group of us, we're really pleased to be able to join into the Global Conversation series. You mentioned a couple of key words as you spoke. One is inspiring and enthusiasm, and this is work I think all of us are extremely passionate about. And as you see, we're going to be discussing how to tackle some of the most vexing problems that you can find anywhere, I think, on the face of our earth. I think you'll also find that there's a very interesting blend of good old-fashioned hard work with extremely high technology solutions to some of these problems. So we do hope, we're really glad to have an opportunity to share this with the UC Davis communities and those around us. We look forward to our discussion. I'm joined today by some key partners for this research program that we'll describe to you. First, we have Sam Owilly, who is the Kenya Program Director for a non-governmental organization called the BOMA Project, and Sam will be speaking to you in just a moment. And then we have two individuals from the International Livestock Research Institute, which is headquartered also in Kenya. We have Watson Lepariyo, who's a research associate at International Livestock Research Institute, and also Nathan Jensen, who's a senior economist and researcher at the same institute. So they'll be speaking to you all in just a moment. The question and chat box is open, so we'll spend a little time sharing some thoughts with you that we've prepared, but then we'll open things up. And so we encourage you to please go ahead and submit your questions as they occur to you, and then we'll do our best to answer them as we get closer to the end of our hour. So my job is to initially just describe a little bit to you about the situation and the work that we're doing, the research that we're doing to try to solve some problems. If you look across the drylands of West, East, and Southern Africa, there are approximately 250 million people who depend on pastoralism. So that's a little bit less than the population of the United States, but it's a large number of people who are in their livelihoods through this mechanism. Our own congressman in the Davis area actually spent time as a Peace Corps volunteer in southern Ethiopia in precisely the kind of environment that you see here featured to the left. Individuals that live in this area find their lives threatened by periodic droughts. And when we say a drought, we mean a very severe event. People depend, like the gentleman in the picture here, on these animals. And in a very short time, a severe drought can basically destroy easily half of everything that people own on which they depend and push their incomes to zero. In Kenya alone, over this 5-year period from 2008 to 2012, droughts cost that economy about $12 billion US dollars. Dropping down to a more human scale, the consequences of these kinds of events are enormous. This is a very poor region, and when they're hit by these kinds of shocks, the impacts on families are enormous, they're long lasting, and indeed there's some evidence to suggest that they may be irreversible, meaning if people fall down because a drought destroys their livelihood, it may be impossible for them ever to recover. So in short, drought events like this makes people poor, it keeps people poor, and it may thrust them into these situations of economic non-viability, or what some economists like me like to refer to as poverty traps. We're not going to focus specifically on climate change. That's actually in the podcast that Joanna mentioned, but climate change is making this problem worse. So the frequency and the severity of droughts are actually visibly increasing in this part of the world. Climate change is also a period of instability. And it turns out in the last long rainy season, Kenya had too much rain in this region. So climate change, as it is in most agricultural and livestock rearing areas of the world, is creating quite a mess. So the question is, how do you react to these kinds of things? And how ultimately, the question we really want to share with you is, how do you alter poverty dynamics in the drylands when you have this dynamic of climate shocks pushing people downwards? Historically, what's typically happened is governments, including the US government, but obviously the government of Kenya's and other international agencies, have responded to these disasters with emergency food aid. That's obviously an important response when people are in difficult circumstances, but I like to think of it as a Band-Aid, right? It comes in, it sees the problem of people in really severe situations of malnutrition and hunger, and it tries to address that immediate need, but it doesn't do anything about the causes that problem. And that really has two implications. I mean, first is if it doesn't really solve the problem, it means you're going to have to do it again and again. And with climate change, you may have to do it again and again with increasing frequency. And the second is it sort of presumes that if you help people out in this moment of acute crisis, they can take care of themselves without any further assistance and move forward. And that simply may not be true. And so the group of us that's with you today from the BOMA Project and with the International Livestock Research Institute, we're part of a multi-year research effort to design and test a program in this area of the world that is intended to fundamentally alter the dynamics of poverty. And as you're going to hear, there are two pillars to our program. The first is asset building, and Sam's going to talk to us a lot about that through what BOMA calls the REAP program. So this is a woman-targeted program, and he'll give us more ideas. But fundamentally, the notion is when people get knocked down so far, you've got to facilitate getting them into a position where they can move forward on their own. And the second is the index-based livestock insurance program that was developed through a collaboration of UC Davis and the International Livestock Research Institute. And we view this as asset protection. So the underlying problem is risk. And so insurance is a mechanism which can allow us to deal with that. So we'll talk that. So finally, then, just to note, one reason we're really excited about this is the REAP program has been shown to really be effective. It can build up assets of women so that they can work their way out of a poverty trap. Evidence shows that IBLI can protect people's assets so that they don't tumble back down. The really interesting thing is the synergies between these and how do these synergies actually work and how does one complement the other? I think this is especially important to think about in the context of how households actually allocate risk within themselves. So I think we can all easily imagine a problem of what we sometimes call intra-household risk shifting. So if the woman in the household has had her assets built up perhaps through REAP, then in some sense, when the next drought event comes along, those assets and that improvement in her situation which has occurred is in fact put at risk. Now, as an economist, as a group of economists, we've done a lot of complex systems analysis of this work. And what we've shown in theory, at least, is that by combining asset protection with asset building, that this can actually be much more cost effective than the Band-Aid strategy, that you can spend about 25% less if you take an integrated program like this, rather than simply letting disasters occur and throwing food at people in a truly difficult situation. And as already mentioned, climate change raises the stakes on all of this. So what we've been doing is trying to move from good ideas in theory and combine these programs together to see if we can really realize this. As Joanna already mentioned, the Unfold podcast, I give the link here, was put out today by Amy and Kat, and we invite you all to go and explore more with that. So without further ado, I would like Sam Owilly to jump in and give us some information about the BOMA project and what they're doing in this area. So Sam, over to you, please.
Thank you very much, Michael, and pleased to speak with all of you this evening, this morning. In this drylands of northern Kenya, BOMA has worked for over 12 years, basically targeting the most vulnerable and using women as the entry point to target the household units. We actually use women because we believe that women are disproportionately affected by the impact of climate shocks and suffer the greatest burden in providing for their households when these shocks occur. So we implement what we call the Rural Entrepreneur Access Program, which is a custom-made graduation model for Northern Kenya or Kenyan drylands. And this is a high-impact poverty-focused model that is actually aimed at building long-lasting resilience. Next slide. So one unique aspect about the graduation, the RIP model that sets it apart from other traditional graduation models is that it begins with a cash transfer, which is then used to be invested to start group-based income generating activity to help sequentially build assets for the women so that they may be able to use those incomes to meet their other critical needs. But the most important part of all this intervention is that we take through a period of 24 months, beginning with a robust targeting approach, which has been accustomed to make sure that it is transparent, equitable, and makes us reach the most vulnerable within that society. So once we are able to target them, also using the poverty parity index, we then set these women and form them into business groups of 3 women, and then provide them with this cash transfer so that they may be able to set up those micro enterprises to begin the income generating activities. What we've also seen is we implement a sustained mentorship program, building the necessary life skills, financial and business skills capacity to support the growth of these businesses and expansion of the same to further build up the assets that we aspire to generate. After about 6 months, we form these groups, bring them together to build savings groups where they bring in their money, pull their money together, and are able to loan and credit one another so that they can also extend that financial access to meet their other needs. The other beauty about this savings group model is that it also provides the social connections and social networks that also the women rely on in periods of extreme shock. So the model itself has a very clear exit strategy that we set from the beginning and that we measure after the 24-month cycle to make sure that we have actually built the assets and the women have met certain thresholds that they can actually be considered as self-reliant. These criteria are grouped into 4, and we looked at their food security status. We look at the income diversity, which is also a very critical element as far as resilience is concerned, and also make sure that they have sustained and diversified livelihoods. Another important piece about that is the shock preparedness and the ability to mobilize finances quickly to respond to any acute shocks. We also look at human capital investment, just making sure that the women are able to access school, the girls are able to access school, and the women themselves get knowledge and information on what they need to do when drought or any other shock strikes. Next slide. So this is just an illustration of exactly what the RIP model steps entail. So like I did mention, we begin with the community entry and targeting, then we issue the cash transfer, go through a 2-year cycle of mentorship and coaching, mobilize the women into savings groups so that they can be able to access credit. But one other piece that we also emphasize is the issue of financial and market linkages, because we believe this is should become climate vulnerable. Next. So far, we began in just 1 county in northern Kenya. So far, we've been able to move into 6 counties, including 1 location in Uganda where we are piloting the same model to see how it impacts in different geography. We are currently planning to move into an additional 4 counties by end of this calendar year. Next slide. So to date, we've been able to realize certain impacts. We've seen situations where women have become suave in conducting their businesses and operating their business groups. And to this extent, we've mobilized over $500,000 in savings. We've actually reached about 168,000 women and children through this intervention and made sure that we, circulate loans, issue loans upwards of $250,000. Our aspiration is to get this to reach about 1 million women and children by 2022. Thank you.
Okay, great. Thank you, Sam, very much. Whoops, sorry. So what I'd like to do based on that, now let's turn to Nathan Jensen of the International Livestock Research Institute. And Nathan, could you give us some background on the Owilly index-based livestock insurance product and how it fits into the overall research design and with the BOMA program? So Nathan, over to you, please.
Sorry about that. Thanks a lot, Michael. Yeah, so let me return back to some of the things you were saying earlier without repeating them. If we want to think about sort of the typical pastoral household, we want to think about a household that relies on rangelands basically for its animals, and these animals represent the majority of its productive capital. So they generate most of their income from these animals and the majority of their wealth. The problem is that this forage, of course, is quite susceptible to climate shocks, as you mentioned earlier. And so when you have something like a drought, forage is not available. Unfortunately, in these areas, there aren't much in the way of forage markets or fodder markets. And so milk production drops dramatically, as well as the productive assets themselves deteriorate. In the extreme cases, as you mentioned, during these severe droughts, we see that there's sort of massive losses of livestock within these households. And as I mentioned, that's a large part of their wealth. So they're losing their wealth and their productive assets at the same time. On the figure on the bottom left, these are data from 2 different longitudinal household surveys that we've run in northern Kenya. The pie graphs are just the different reported causes of livestock mortality among households. We see that the vast majority is the blue, which is losses due to starvation and drought. The second largest cause is the red, which is disease, which is highly correlated to drought. So drought really matters for these households in income and for loss of productive assets. Of course, households respond by coping, and so you can do something like migrate or split your herd, but this can be costly for a number of reasons. You could sell your animals, which is also challenging because often prices are falling during drought, but the body condition of the animal has also deteriorated, so you're getting a lower price for 2 reasons. And as you mentioned, there can be long-term implications of selling off your productive capital, the sort of so-called poverty traps that you mentioned. And then finally, of course, there's this number of other options that people depend on: remittances, taking on debt. But then we also see people reducing consumption frequently. And I'll come back to sort of some of these points as we move forward. Next slide. So the objective of the index-based livestock insurance product then is to mitigate the impact of the drought. We do this using satellites. So satellites take pictures of the ground. There's different sensors up there. The one we use is used to develop a data set called eModus. And that's basically a repeated picture of the ground's greenness over time. So every 10 days, we get an observation of the ground, how green it is. Because there's repeated measures starting in 2002, we're able to aggregate those repeated measures over time within a season and look at what does a season normally look like. So we can look at, this is a normal season, this season was greener than normal, the season is worse than normal. The top 2 figures are of Marsabit County, and this is an example. On the left is Marsabit County in 2010 May, which was a good rainy season, so it's greener than normal. And on the right there is the same location in the same month, but the year after, in 2011, when we were starting into a large drought. So you can see it's physically redder, but it's also illustrated as being less green in this area. So this is a drought period. You can imagine writing an insurance product off of this, saying if things get much worse than normal, statistically, we can develop some sort of empirical distribution and then say if it's worse than this threshold, we can make a payout. I guess one question that's not mentioned in this slide is why would we want to do this over a conventional insurance product? Conventional insurance is much too expensive to offer these smallholder farmers in this area. Just the challenge of going out there and assessing their risk means, developing some sort of profile for each individual, determining what their premium is, and then if they have a loss, they would come to you and tell you, I have a claim, I'd like to get paid, and then you'd have to travel multiple days trekking around in the bush looking for the animal and identify it as them. So there has never been a livestock insurance product in these areas using sort of the conventional approach. So this index insurance product is a way of circumventing many of those costs because you write the policy off the index itself. So everybody in an area gets a payout as a function of how much insurance they purchased and a function of the rangeland condition, but you don't actually go to them and ask them what happened at their household. These policies were developed through a collaboration with UC Davis, and since 2010 have been sold by commercial insurance companies across northern Kenya and southern Ethiopia right now. Further, this Owilly product has been integrated into the social protection program of the government of Kenya through the Kenya Livestock Insurance Program, which buys 18,000 policies on behalf of households. So it targets households that it thinks could benefit from insurance and buys insurance for them. Next slide. Before promoting this product too much, of course, we did a number of impact studies. This map on the top right shows outlined in red are the different index units where we're currently selling index insurance. And then there's a number of places that are shaded in different ways where we're currently in one degree or another sort of negotiating or working with NGOs or country offices to develop index insurance products in those places. We do this because we know that there's positive impacts of this product. We see that there's impacts on production. So households that are insured, they know that they're safe from drought, so they start to make investments in productivity or in increasing productivity. During drought, we see that there's good impacts, and then at the welfare level as well. Next slide. So now to this program, we have this one program, REAP, which has been shown to have positive impacts on households. It's able to help lift poor households up out of poverty. But of course, these households would continue to be vulnerable to shocks. We have another product, Owilly, which has evidence that it helps protect people from shocks. And there is some evidence that it helps build their income, but there's not much evidence that it can actually protect them or bring them out of poverty at this point. So it's more of a protective product. So the idea is, what if we combine these two products? We use the asset building intervention to bring people up out of poverty, and then we use this asset protection program to keep them there. Back to you, Michael.
Okay, thank you, Nathan. So, as I think we've seen from both Sam and Nathan, this is a very, in some ways, very labor-intensive opportunity and set of programs. And as scientists, we're of course really interested in understanding whether these programs work. So we've seen a lot of photographs in the different slides, so you're getting some sense of the location in the space. And I wanted to turn to Watson now, who works for the International Livestock Research Institute, along with Nathan, to give us a little feel for how do you actually run a research program in an area like Samburu County, a fairly isolated area. It's too distant, too remote for insurance agents and banks and others to go there, but nothing's too hard for a well-motivated researcher like Watson. So Watson, please give us a little feel for what it's like on the ground as you try to implement a research program looking at this exciting combination of programs. So over to you, Watson.
Thank you, Michael. Yeah, so as you mentioned, so as Sam and Nathan have mentioned, that is pairing of two interventions at the same time. So maybe to give out a bit of a perspective of where this is happening. So this is happening in Samburu County, which is one of the northern Kenya county, and it's happening in the northern part. And the two interventions are being implemented in 5 wards. Those are administrative units in Kenya. That's Nyirondoto, Alberta, Anata, and Bawa, as shown in the map on your left. So in these, first, before we began implementing these activities, we had a sit down in BOMA, and BOMA did the actual targeting, which was sample selection through participatory rural appraisal and also individual verifications. So they came up with a sample that we selected and pooled within the RCT, having different groups that receive different treatments. So we have the control group and a group that receives index insurance, and we have a group that receives only RIP. Then we have a group that receives both. So then again, within the insurance subsidy, as we offer discounts, we have different levels of discounts. This is just as part of the study to test the effectiveness of these products, and to also try and, because it's a new product, and I think for the insurance on which I'm quite comfortable to speak about, I think from what Nathan has explained, it's not taking it to the community now is the hard part, because it's made of concepts that are hard to grasp. So as we're doing the field activities and collecting data, we are distributing discount coupons, and also within that we are doing extension just to teach the community about this product and the potential that the product has. So within the study, the groups that are represented are the vulnerable ones within the community and the poor households. So they receive different treatments according to the wealth ranking. And the total sample for the RCT is 1875 participants. Next slide. So far, the implementation of the activities, we have two partners now, including Owilly also. So Owilly does the survey work, where we prepare the survey tools and conduct the actual surveys in the field. Then we have BOMA running the Arid program. Then we have now the commercial partner, that's Health Insurance. That's Takaful Insurance of Africa. So we have, so far within Owilly, we have had 3 surveys. That was the baseline survey. Then we had a let's say before midline survey, we had sort of a small survey which mainly included coupon distribution and extension work. And additional to the 3 rounds of survey that we have had, we've also had a few studies within the RCT participant that's conducting games. That was mainly done to understand the gender dynamics within the provincial of insurance. So the framing of it and how different genders take up the insurance according to how it's framed. Then again, recently in the wake of COVID, we have had a research, which was a phone survey to just understand how these participants are faring on with the new shock that's COVID introduced, midst of all the other shocks that are like drought, as Nathan mentioned, and diseases. So as we do the survey work, we always have challenges, and as Michael mentioned earlier, conducting surveys in a remote area where the terrain is hard to navigate, and sometimes the road is not quite as good as you'd want. Also, tracking respondents that are pastoralists, so they constantly move around, is a bit of a challenge, where there's no connectivity. You can't call someone and know their location, so you have to physically go. That involves trekking for miles sometimes. So again, during the registration process, we had an issue with the IDs, the identifications for the participants, which makes it a bit of a challenge when trying to track them and also registering them for the program. So next slide. So after doing the fieldwork now for 3 years, we have learned a few lessons and had experiences that continue to build up the work we do, and also trying to better from the lessons we learned. So having contacted the games, which was quite of an interesting experience, using this digital tool to try and simulate the life of a pastoralist, was quite interesting. And for the participant, it was really a great way of learning about insurance in a short period. We had this game that was quite interesting to play, and it had decisions that you will make within the game that reflect to the real life decisions. So it was an interesting way of people learning quickly about insurance and how it works. Then again, this being a new product and involving satellites, involving calculations, and you're taking it to a remote area where people don't understand satellites quite much, and like bringing up this concept at once and trying to teach someone takes time. So we have extension. We've done extension for quite, like we've done for now 3 rounds, but still feel like the better way for people to, because in the end, this product has to be commercially viable. So for people to buy in, they really need to understand. So more extension would be beneficial for that. Then again, for the women that are participating in BOMA, they are notable among their peers. You could see that they have confidence even when doing business. And from the mentorship, you will see some level of confidence and self-reliance, even as they conduct their day-to-day sales in their kiosks. For some that are participating in livestock trade, which this trade is normally dominated by men, it now brings gender balance in trade that's mostly dominated by men. So you see women participating in them, and they're using these BOMA grants to participate in them. So it builds, it gives them access to, because livestock is a big industry here. So if they have access to that, then it's a great thing for women also to earn income through that. So yeah, for some that are able to grasp this concept while explaining to them and just understanding why are we bringing insurance to them. This is sort of have a buffer. When the drought comes, you are sure that you're covered, and you will receive something that will spare, let's say, selling 3 or 4 emaciated cattle to earn, let's say, income for basic needs. So you'll have this payout that will sustain you through the dry season. So for some that get the concept, they truly value the intention of it. So yeah, those are the lessons we've learned so far from the field. Over to you, Michael.
Okay. Thank you, Watson. I'll just mention to the audience that if you have an Android device, you can download the Sim Pastoralist app, and you can try your hand at being a pastoralist, and you'll discover very quickly it's hard to do well in this kind of environment. So as we all know, as we're sitting here doing our millionth Zoom call of what it feels like it anyway of the last 6 months, COVID has really landed on all of our heads. Watson, you're actually from Maralel, which is a small trading town, market town in Samburu County. What do you hear from, what's going on back home? What are the kind of the immediate impacts that you hear about in terms of the impacts of COVID on people's livelihoods and the economy and the society in Samburu County?
Yeah, so as you mentioned, Michael, I come from Maralal, which is within Samburu County, and majorly the biggest, let's say, income earner in this sort of a region is mostly livestock dependent. And in the wake of COVID, we've had like these measures to try and mitigate the spread of COVID, which have had negative impacts on the livelihood that people depend on. So just to mention a few, like when in Samburu, we first recorded our first case that was in August 4th. That was around 5 months after Kenya recorded the first case, that was in March. So as early as March, we had livestock market closure, we had restricted movement, social distancing, and even closure of schools. So just to think through and to see what has been happening since we had these restrictions brought in. As for the livestock market closure, that was a big blow, because now, like most of households here depend on selling livestock to purchase basic needs, or even like owning kiosks within the market that they sell to pastoralists that come and sell their livestock. So in one way or another, there's a direct impact or indirect impact if markets are closed, because now you have these households that normally sell livestock to buy basics, but now they can't, which in turn now reduces their purchase power. The liquidity of these families is reduced. So purchasing basics really becomes hard. And also restricted movements. That the biggest impact of that is transportation increased. The transportation cost for transporting commodities increased. So in to respond to that, traders also increased the price of commodities. So now you have a household that cannot sell livestock, and you have increased prices of commodities. So meeting basics becomes a challenge there. Mm-hmm. So to me, that's like the biggest impact. And also, if you think about restricted movement in terms of, let's say, NGOs that work within the area, and even government services that, let's say, veterinary services that we get from the government. Now that government officials or NGO workers cannot come into the community to deliver those services, you have like, if there's an outbreak of a disease that could have been prevented, mm-hmm. You have losses of livestock due to the disease. Yeah. So to me, it's the measures, as much as they are in good faith, but still they have far-reaching effects to the community.
Okay, thanks, Watson. Well, based on those kinds of reports that Watson just shared with us, the research team thought it important to see what we could find out. And, in particular, we were very worried that this complex process of asset building and protecting assets against droughts, but COVID is this unexpected shock. So Nathan, can you tell us a little bit more about what we've learned, or preliminarily learning about the impacts of COVID using the study sample that we have?
Yeah, a couple more things to mention that were taking place at the same time, because I think it's interesting. So we had COVID coming in sort of mid-April. We had a lot of sort of shutdowns and things like that, and that's when we started discussing the survey. But at the same time, there was this locust invasion coming in across the Horn of Africa, and the sort of on the other side, the end of 2019 ended with really good and long rains and into early 2020. And so, Watson was doing a lot of information collection for us on the ground at this point. And we were trying to understand what was going on, and the rangelands were great. People were feeling happy about the rangelands, but the markets were the problem. The locusts, they said, Watson even told me a story that some people said, oh, the locusts are fine. We don't even care about them because they only come when the rangelands are good. So they're happy. So it's a complex system, right? But we knew that there was this issue with market closures, and most of these markets opened up pretty quickly afterwards, but people still reported some uncertainty about if a market was going to be open. So they couldn't plan around it very well. And transportation continued to be high. So individuals' transportation vehicles were supposed to run at 50% capacity. So people were being charged more. But this also meant, a lot of transportation just no longer existed. They just didn't run because they couldn't make their money. So by the time, what we did is we collected a household survey from the people that were in the RCT. We used those households that had a registered phone number. We collected it during the midline survey. We called those households up, and we had about 1,000 households that had a phone number registered. But of course, there's not very good network out there, and a lot of SIM cards sort of get swapped out. And so out of that 1,000, we got a hold of 300 people about, and we surveyed them about all sorts of things. And we don't really have time to go into it now, but because I think we've focused a bit on sort of this sort of typical livelihood of the pastoralist, where you produce animals and you sell some animals at market to buy staple goods for consumption. I'm going to report a couple of the findings we have around that. So households pretty much across the board reported that they were receiving lower prices than they normally would for this season for their livestock. So the prices for livestock went down. And then they reported that the prices for maize, is what we asked them specifically, had gone up. And we actually asked them to estimate the price of what it would have been in a normal year and what it was now. And so what you see is, of course, the animal price goes down and the maize goes up. So if you're going to sell a goat, for example, to buy maize, the numbers show that in a normal year, you could sell, when you sold one goat, you could buy 52 kgs of maize. And under this sort of like COVID situation that people were facing, you can only buy 37 kgs of maize when you sell that same goat. And so it's not a different goat that's deteriorated, it's this sort of the goat with the same body condition. So what does this mean? I mean, you can either sell more goats, so you can sell almost a goat and a half for every time you would have sold a goat before if you want to maintain consumption, or you can sell fewer goats or the same number of goats and reduce your consumption. And we see all of these things across the board. We see that there's households, about a third of them reported selling more goats. So these are households that are saying we need to sell goats because we need this maize for consumption. We have about 2/3 that report selling fewer animals. So these are animals that, sort of to use some of Michael's earlier language, are trying to protect their productive assets. They're saying we need these animals sort of on the other side of this shock. If we sell them off now, we're really going to be struggling on the other side of this thing. So they're going to try to maintain their animals. So what do? They have to reduce consumption then, or substitute in some other way. And this is sort of the large findings that we found where we saw a lot of small changes on the margin where people were traveling less or selling a little bit more, a little bit less. But then once we got into these, what we call coping strategies, we saw a large increase in sort of the most dramatic one was that we saw a doubling of the number of households that had an adult that go an entire day without eating between February 2020 and August 2020. And so February was sort of before the first COVID case arrived in Kenya, and August was sort of a while back. COVID wasn't there very strongly, but it had affected a lot of policy decisions. At the same time, when the survey was being collected, these were households that were, the rangelands were still doing pretty reasonably well. And so this wasn't drought related at all. For a number of other coping strategies, we see the same sorts of outcomes where they increase pretty dramatically. And so the question will be, and we haven't really been able to do the analysis yet, and it's challenging to do it, is how did these programs, which we know from midline analysis, were supporting these households quite well. So we saw that there were some positive impacts of the programs at midline. How will they interact with this COVID environment? Will the REAP households now continue to be able to maintain the benefits that they had from REAP over COVID, or will they somehow sort of lose many of those benefits? And we don't know the answer to that yet.
Yeah. Okay, thank you, Nathan. And I happened to see on the news last evening, the appearance of hunger in the United States. I think to give our audience a sense, in good or normal times, roughly a third of the people in our sample will have to go at least one day a week without eating, which is a real severe measure of how poor people are. And that has almost doubled under COVID from a third to 2/3 of the sample. So this is, we see the situation in the United States is obviously severe, but I think this gives us another window into a different place. So finally, let's, Sam, if we could turn to you. So BOMA operates not only in Samburu County that we've been discussing, but parts in Uganda and other parts of Kenya as well. What are you all thinking about how well the REAP program will survive the uninsured shock of COVID and the kinds of pressures that it's put on the households that you work with?
Yeah, thank you, Michael. So we actually suffered a big hit because in the process of asset building, we do micro enterprises, which includes convenience stores and even livestock trade. And this was severely impacted by the restrictions which came out of COVID, the closure of markets, price hikes that came because of travel, challenges with traveling and so on. So BOMA, we undertook a 3-step approach, which included assessment, adaptation, as well as advocacy. And under assessment, we simply deployed quick surveys to help us understand how the markets were functioning in different locations where we operate. We also undertook knowledge, attitude, and practice surveys, as well as behavioral analysis to also determine the awareness level, as well as the impact of the pandemic on the households, the stress levels, and so on. So what this actually gave us, was that we needed to make some market level interventions, which included connecting the businesses with suppliers and making sure that we negotiate or we facilitate price negotiations between bulk suppliers and the women so that they're able to get the supplies in a more affordable fashion. Under knowledge, attitude, and practice survey, we were the first people to, for example, leverage our extensive mentor network as well as technology to deploy approved information and communication materials that was used, and train our mentors that was used to pass the message of protection and safety to the women so that they don't actually suffer the risk of exposure to the pandemic itself. So through this and on adaptation, we deployed we quickly pivoted to remote monitoring using mobile phones, because we also realized that this was not the time to run away from these women and drop them, because they relied on us to be able to meet the household needs. So we quickly pivoted to mobile and remote monitoring, deployed tests to try, for example, interactive voice recording technology to provide that remote mentorship and so on. We also intensified financial and market linkages to try and improve the situation, and we saw that working, as well as taking advantage of the stimulus packages that were rolled out with government that injected liquidity in the markets. And we saw, for example, women moving from, for example, livestock, which was stranded, into maybe convenience stores, which had market value at that point. So all these efforts, we were also able to engage with other external parties to buy in support, so that support can be maximized. And we were able to get so many partners on board who came to work with us for longer term purposes, because we realized that there were multi-level shocks. There was the pandemic, yes, but before that there was locust, and before that there were also floods. We realized that the women will need probably more support to be able to get back to their feet. And so we negotiated for certain stimulus packages, which will be provided so that they're able to rebuild their businesses and recover from the effects that has been witnessed so far. Yeah.
Okay, thank you, Sam. Maybe we can have you come to the United States and help us negotiate a stimulus package as well, because that's currently quite a topic of political controversy. We have about 10 minutes left, and I'd like to ask Sophie Javers, who's a linchpin player in the Markets Risk and Resilience Innovation Lab. She's been monitoring the questions that have come in. Sophie, would you like to jump in and direct some questions to us?
Sure. So we have some great questions. Thank you, everyone, for sending them out. Steve, thank you. We have two that are kind of similar. Steve asks that women are disproportionately bear the brunt of climate change. Why is this the case in pastoralist settings? If the direct impact is livestock, morbidity, or mortality, wouldn't the owners of the animals be most adversely impacted? And then Aaron Hughes has a similar kind of follow-up. I'd like to learn more about the shift of risk within the household among men and women. Can you provide an example and the impact? So I'm not sure who wants to take that. Maybe Sam, if you want to start, and then someone else, Michael or Nathan, to follow up.
Well, maybe I can say just a tiny bit and then pass it over to Sam as well. But at least speaking as an economist, if you sort of, households need to make decisions, and as we all know, in many cultural and social situations, women may be in the weaker position. And so in terms of who becomes responsible for the basic family decisions and taking care of family. So intra-household risk shifting is simply a fancy word to suggest that in times of stress, even if it is the man's animals who are directly most impacted, that the man may say, look, I've got to hold on to the livestock. I can't sell those goats, because if I do, and he says to his partner back home, you figure it out. And that sort of, pushing that responsibility back to the woman is something we see in a number of places, and women's assets, whatever they might individually hold, are often exposed. And that's actually been the key to how we've been trying to make livestock insurance resonate with women and it was absolutely an easy sell, because as soon as you say, well, yes, the men own most of the livestock, but in fact, you all know that when the livestock are under stress, then that becomes your problem. And so we've actually been experimenting with ways to market the insurance as a family insurance that women can buy to sort of help protect the expenditures and the responsibilities that they have in terms of taking care of the family. So that's a quick response. I don't know, Sam, did you want to add in anything further on that?
Yeah, that's actually it, Prof. And just to add that traditionally also, these are patriarchal societies, and women are, considered quote unquote lesser in terms of decision making. And also the men during these extreme shocks migrate with the animals to, dry season grazing lands, leaving the women behind, and most oftenly without income to support the households.
Yeah. Okay. Great. Thank you. Sophie, another question for us?
Yes, we have also from Professor Boucher. In the introduction, you stated the importance of understanding risk dynamics within the household. Can you expand on this? So I guess this is a little bit more about what you were just discussing. Did you mean that in a given shock, such as drought, you may have different impacts on consumption or work of husbands versus wives? Or do you mean that husbands and wives have quite different attitudes towards risk and insurance? Can you tell us what you found? So maybe elaborate a little bit about the marketing aspect of the work.
Sure, yeah. So I don't want to overly generalize on this, but I mean, there certainly is a pattern, and I think Sam just touched his finger on it. Is that if there is a severe drought, the men may literally leave, and if they're in bad situations themselves, then they leave the women with very few resources and sort of count on them. And this has really been the real reason for trying to combine the insurance with the asset building, because as Sam was saying, with COVID as an uninsured kind of shock, there's this concern that a stimulus package is needed to allow people to keep their small businesses going from this unexpected kind of event. But even when it is an expected event, if the woman has slowly built up some assets, and by the way, our preliminary study from the data are showing that women in the REAP program have assets that are about 200% higher than they were when they began. So some real substantial asset building. And yet when the drought comes along and if the livestock are under stress, the concern is how will the woman be able to protect those, especially if she's enmeshed in a patriarchal society that tells her that, that she has very little decision-making power. So a large part of what BOMA works on is actually empowering women to have voice within their own households and in a sense, get a better deal. And that's something we're continuing to investigate. And we're actually quite interested in seeing whether the security that insurance can provide to women actually empowers them further and gives them a stronger voice in their own household. So, they're not that person that doesn't eat once or twice a week exclusively.
Great, thank you, Michael. I think we're about 1 minute to the hour. So if there's any last comments from the other panelists, please feel free to add your thoughts, or if not, then Michael, if you could wrap up for us.
Yeah, Nathan or Watson, did you want to chime in a little bit on those, or any other thoughts you had as we went along?
Yeah, I'd just like to mention one thing that was mentioned pretty early on, but maybe we could just to bring this to the forefront of people's mind, is that the households that we're engaging with in this project are specifically targeted the poorest households with women in them. And so there are the percentage of sort of, single parent or single adult households is much higher in this population than it would be in sort of the general pastoral population. So we're targeting, and the other thing is that the households have many fewer animals than sort of these. So you might have a community where there's a couple of people with large herds, but then most of the households will have much smaller herds. And those are the ones that we're targeting specifically.
Okay. Watson, any final thoughts for us?
Yeah, I mean, just to mention a bit on maybe what Nathan was saying, like within the community that we work with, we focus on maybe the ones that within the ladder of let's say the way they are clustered in terms of wealth ranking, the lowest. So we have the vulnerable ones and the poor ones. So the target is majorly on the poor ones. So what maybe that can also explain better the shift in the risk, where now in some aspect of let's say household decision, the women shoulder more because the household doesn't have so much of the productive assets.
Okay, great. Thanks, Watson. So let me just thank all the panelists for participating, in the audience for bearing with us. We hope you found it interesting and stimulating. A lot of learning is going on about how to do this, but sometimes you get unexpected spillover learning. So my colleague Steve Boucher and I are actually trying to take the satellite technology that we've been perfecting to use in northern Kenya, and we're actually working on implementing that for ranchers in California. Watson and Sam, maybe you don't know this, but there's a lot, they're not pastoralists, but they do have lots of animals. So we're actually trying to bring some of that learning back to our home state. Anyway, thank you all very much. I don't know, did Joanna want to make a final word? Okay. Sorry.
I am unable on the video, sorry. The host enabled my video, so
Okay.
But anyway, thank you so much to the panel. It was really interesting, and I learned a lot, and this is definitely an area of extreme importance to me. So I truly appreciate all your efforts.
Okay.
Empowering women and recognizing really women's leadership and helping the communities to live on. Thank you so much to everybody.
Thank you, Joanna. Thank you, everyone.
Thank you, Michael.
For the audience.
Thank you. Bye.
Bye-bye.